Coming to the question, how has the world changed or what has been revealed by the global COVID-19 crisis? As we know that health has a significant place in the 2030 Agenda of Sustainable Development Goals, as good health is indispensable and integral to achieve the global goals. We need to realize that the sustainable development and global health are inextricably interlinked and affect the human well being. Besides having a devastating effect on the global health, the COVID 19 pandemic has adversely affected nearly all the sustainable development goals. As the situation is today, hunger, unemployment, and inequality stand exacerbated. Children and youth are getting deprived of the quality education due to closure of schools and colleges. There are reports of domestic violence against women which are on the rise. The documented reports point out that the present pandemic could lead to increase in child marriages and can lead to about 7 million unintended pregnancies, as a large number of women are unable to gain access to family planning measures due to lockdown. The vulnerable regions of the world, conflict infested areas, drought regions, and areas sheltering refugees are experiencing shortage of food and clean drinking water due to impediments in the food supply chain, inadequate sanitation, and erratic power supply. The high population density and inadequate medical facilities make such areas more prone to COVID-19 infection. The reports of COVID-19 patient developing secondary bacterial infection leading to an increased use of antibiotics and consequently development of antibiotic resistance are a cause of concern. Apart from these effects, the present pandemic has caused a shift of focus from the other threats to the global health, such as air pollution and climate change, non communicable diseases, Ebola, weak primary care, vaccine hesitancy, tuberculosis, dengue, and HIV to COVID 19 only, with almost whole of the research activity and action centered on the issues related to the COVID 19 pandemic. Though much progress has been made in improving the healthcare sector throughout the world in the last few decades, yet a large chunk of the global population has no access to affordable healthcare. The problems such as affordability and accessibility, limited resources, inadequate investment, lack of public trust, deranged physician patient relationship, violence by segments of the misinformed public, and low quality of healthcare are common in many countries world over. Due to extraordinary and sustained demands on the healthcare systems around the world, the COVID 19 has put immense strain on the healthcare providers, especially doctors and nurses. The health system in many regions of the world, especially in the global south countries, are experiencing unprecedented strain due to limited resources. In fact, in such areas, the health systems are routinely overwhelmed, even in the absence of pandemic and other health emergencies. Though many measures have been lately conceived to improve the health delivery system during the present pandemic, these have been implemented in emergency mode and are essentially reactionary. Therefore, the present pandemic has laid bare gaps in our healthcare systems that need to be addressed in near future. Coming to the other theme of this talk, that what challenges we have to tackle post-COVID era, in the post-COVID era. We need strong and resilient health system that are the best defense not only against the pandemics but also against the multiple health issues that people around the world face on day-to-day basis. One thing the COVID pandemic has taught us that during pandemics, even in the developed countries, the existing health system can easily be turned inadequate and insufficient, and the world needs more investment to strengthen the health systems. One of the most important challenges in the post COVID 19 era will be to build robust healthcare systems, and one of the most important barriers to it is the lack of effective public healthcare leadership. The world needs effective leaders for solutions of the issues that are plaguing the health system worldwide. The healthcare systems, though lagging in many aspects, require a collaborative culture and teamwork. Efficient healthcare establishment need effective leaders. The solutions to such pressing issues have to come from strong physician leaders. The modern healthcare system is dynamic and requires a collaborative culture and teamwork. The physicians, who are usually the primary and the first point of contact for the populace, have an opportunity to lead the change. As far as evidence-based science advice to governments pertaining to health is concerned, physicians have the first-hand knowledge of the government policies along with the attitudes, beliefs, and concerns of the population, which directly or indirectly affect the healthcare. Hence, it is imperative to tap the know-how of the physicians not only in managing the patient during the pandemics, but also in strengthening the health systems and health policy. While physician leadership is vital for better healthcare, this is not usually a part of their medical training curriculum. Some of the leadership qualities that need to be incorporated into the young physicians are the teamwork, collaboration, emotional intelligence, resilience, mindfulness, advocacy, self care, conflict resolution, negotiating skills, interpersonal skills, influencing and motivating others, and effective communication across different levels of the organizations. The need for young physician leadership was never felt as stronger as is today in this time of global COVID 19 crisis. Needless to add that there is a need for dedicated leadership programs for the young physician scientists in order to groom them as the healthcare leaders of tomorrow.